Thank you very much. Good morning, everyone. It's my pleasure to join you from Rotterdam, the Netherlands. Today, I'd like to present you about the results of our research entitled The Impact of Switching from Cytology to HPV Screening on the Projected Cervical Cancer Elimination Timing. As you know, that this research is a collaboration between Erasmus MC in the Netherlands and Institute of Oncology of Ljubljana under the Utopia is project that is funded by the Horizon 2020 EU program. To start with, let me introduce you by myself. My name is Abyan Irzaldy. I am a medical doctor by training and also an epidemiologist and a statistical programmer. I did my medical degree in Indonesia, and then I moved to Sweden at the Karolinska Institute. And then now I'm wrapping up my PhD in the field of evaluation of cancer screening across Europe in Erasmus MC, the Netherlands. So to start with, as we know that we do have vaccination, effective vaccination that is effective, and then also screening. And in combination of that, it is possible now to eliminate cervical cancer as a public health problem. And based on WHO, the threshold of reaching elimination is 4 per 100,000 women for the incidence. And then where is Slovenia right now? If you see on the graph on your right side, it shows the incidence of Slovenia over the time. And then based on the latest data of 2024, I heard that it's very close, like 4.6 per 100,000 women. That is remarkable. Also, we know that Slovenia has established a high-quality cervical screening program. Despite of still using cytology as a primary screening method. But we still need to realize that HPV, based on the literature, based on studies, is more sensitive in detecting cancer and more effective tests. And also, one of the benefits is HPV test allows us to reach hard-to-reach women with self-sampling tests. So, the question is now, can switching from cytology to HPV screening help Slovenia to eliminate cervical cancer faster? To answer that question, we need to perform a kind of epidemiological projections to actually know what happened in the future. So specifically, we want to know what happened if ZORA decides to keep continuing current cytology screening as you guys have now, and then switching from cytology to HPV screening. And then finally, what would happen is switch to HPV is supplemented with the efforts to increase participation through sending out self-sampling HPV tests for women who never attend screening. So a bit more technical, how do we do that? So what we did in this study first is to gather data from Slovenia. So with collaboration with Slovenian researchers, we were able to collect several types of data from population data, randomized trial data that is specifically in Slovenia, screening program data from ZORA, and then cancer registry data, also vaccination, and then epidemiological HPV data, and etc., and etc. With those data, we input those data into a computer program that is based on a mathematical simulation model called MISCAN STD-SIM. Within mathematical simulation, it's a lot of calculation, probability distributions. With this, we simulated a virtual population representing Slovenian populations. And then with that, we can test different type of policy and what would be the outcome. As you know, that this model has been used in the United States, in the Netherlands, in several European countries, and in Canada to inform about their national cervical cancer prevention efforts. And in this study, we want to apply this model to Slovenia using Slovenian data. After that, we simulate different screening scenario. First, what happened if Slovenia just keep continuing with cytology screening? Or at one time, if you decide to switch from cytology to HPV, and then we will calculate the incidence of when do you reach the elimination threshold of 4 per 100,000 woman years and estimates whether switching to HPV will reach elimination faster or not. So in the next slide, I will present you the result. So now you have a graph with x-axis is calendar year from 2020 until 2100. And then in the y-axis is the incidence. And then there is dashed line here representing WHO elimination threshold of 4. And then there is also vertical dashed line here representing the moment if Slovenia decides to do changes in their policy. And we assume current vaccination coverage and participation. So now you're seeing a green line. This green line represents a scenario where ZORA continues current cytology screening tests. With this, we estimate Slovenia to eliminate cervical cancer as a public health problem around 2032. So here in this intersection line. And then now you're seeing a yellow line that represents what if ZORA decides to switch to HPV tests. And then we estimate the elimination year around 2031. So I'm gonna explain it a bit what happened around here. So when Slovenia decides to switch from 3-yearly to 5-yearly, there will be an initial decrease of incidence because suddenly Slovenia moved to longer interval, which means that every year you screen less women per year. And then few years after that, there will be a temporary increase of incidence because HPV tests able to detect cervical cancer or precancerous lesion better. And then after that, there will be a dramatical decrease of incidence that is lower than cytology. And then you now have a purple line here. This refers to a scenario where in addition to switch to HPV tests, ZORA also decides to sending out self-sampling tests to women who never attend screening. What happened is the same initial decrease followed by a temporary increase and then a dramatical decrease even lower than cytology and switching to HPV tests only without self-sampling. With this scenario, we expect the elimination is around 2031. Other than elimination, of course, there are other indicators. For example, how much we can prevent cervical cancer deaths in each scenario. Here we see with current cytology tests from 2020 until 2100, we expect cytology screening to prevent 1,891 cervical cancer deaths. And then with HPV tests, we expect the prevented cervical cancer deaths to be 1,976. And then with the addition of self-sampling HPV tests, we expect more cervical cancer deaths prevented at the level of 2061. So that is the results. But the question compared to previous studies is that why the expected elimination year is not so much in Slovenia. It is 2032 with cytology and 2031 with HPV. Possible explanations is the incidence is already low in Slovenia. So the expected elimination, expected fasted elimination year is less as well. And then the current cytology protocols in Slovenia is relatively more frequent than other countries, which is every 3 years from age 20 until 64. And then, of course, cytology screening in Slovenia has been organized at high quality. A lot of effort to assure that the quality of cervical screening, although it is cytology, organized at high quality. But we need to understand that HPV test is expected to prevent more cervical cancer deaths in Slovenia. And based on previous studies in Slovenia as well, it is more cost effective. So that is something worth considering. To conclude, with current cytology screening and vaccination, Slovenia is expected to eliminate cervical cancer as a public health problem around 2032. Switching to HPV screening will result in similar elimination year around 2031. HPV screening will result in lower long-term incidence and prevents more cervical cancer deaths than cytology. So if I can end this presentation with a take-home message, I have several things to say. First, I want to congratulate Slovenia with the efforts that with this incidence so low and with our modeling study, it is possible that Slovenia could become the first countries, if not the first country in the world, to eliminate cervical cancer as a public health problem. With our modeling study, we expect elimination of cervical cancer can be reached in Slovenia in less than a decade from now. Now, the real challenge is how Slovenia gets there by maintaining progress towards eliminations, balancing harms and benefits of screening in the era of vaccination, and ensuring no woman is left behind. With all those challenges, maybe switching to HPV screening can be an important step in that direction. I am Abyan Irzaldy, and thank you very much.